Hello and welcome to PolitiPeeps. My name is Edward Hofer, and today we are with Dr. Mary Ruwart, and we're going to talk about the FDA. This is a more free-flowing conversation than we normally have, so let's just get right into it. Dr. Ruwart, what's your background with the FDA? How have you interacted with the FDA in the past?
Well, I was at the Upjohn company for 19 years, and my job was to discover new drugs and develop them, get them out the door. And the first impression I had, my first year when I came to Upjohn, was how does any drug ever make it to market with all these changes and regulations and everything that happen with the FDA? And as I did more with the company, and we're talking now mid-70s to the mid-90s, the regulations got more and more and more costly, and it took more time. And after I left, I decided I'd look into this a little more and found out that there's been so much research done about pharmaceutical development that you can actually calculate how many years each of us have lost to the FDA regulations. And I estimate it to be at least 5 and possibly as much as 10 years that each of us have lost of our lives. It's quite sad, actually. We were poised on a golden age of health in the 60s, and that never came to fruition because of the 1962 amendments to the Food and Drug Act. What had happened is there was a drug called thalidomide that had been approved in Europe, but not in the US. It was just being tested in the US. And this drug actually started out as a safer sleeping pill than barbiturates. And it was safer than barbiturates for adults. Unfortunately, what happened is after some women took it during pregnancy and found out that it relieved their morning sickness, the company decided that they should market it for that, and many women took it. And unfortunately, if it was taken in the first couple of months of pregnancy, then there was a good chance the child would be born without a limb or maybe die in utero. So it would never actually be born. So there was a lot of concern about this. And I remember as a young child of about 11 or 12, seeing pictures in Life magazine of these poor children. And so even though it hadn't happened in the US because the FDA had the power to stop drugs that had side effects, and even though the FDA examiner for that drug had been focusing on a different side effect, peripheral neuropathy, the Congress decided that we should have even stricter rules. But the thing is, the rules that they took had been floating around in Congress for 2 or 3 years, and they had nothing to do with safety. They had to do with effectiveness. And so they were what was instituted in '62. The thing is, it wasn't really just about effectiveness. It was kind of open-ended, and it really discouraged examiners from approving a drug. Why? Because unlike before, where the FDA just had to wait for a couple months and say nothing. If they waited 6 months and said nothing, the company could market the drug. But now, after the amendments required somebody to put their neck in the proverbial noose by signing on the dotted line that they supported this approval. So naturally, no examiner wanted to sign that, because if the drug had a side effect that came to the attention of the American public, Congress would beat up on the FDA and that examiner.
Yeah.
And the problem is all drugs have side effects, right? So it was just a matter of time before you were going to get called in front of Congress and totally be defamed.
Mm-hmm.
So instead of taking 4 years for a drug to get from the lab bench to the marketplace, as time went on, it got up to 14 years. And it would have even been longer, except that companies got much more efficient at meeting the increasing regulations. For example, normally what you do is you would dose your rats with different doses of this compound, this new drug, and see, are there side effects? And if you saw side effects at a particular dose, that kind of gave you an indication how much to give in the next set of studies, which was multiple dosing of these rats, right?
Mm-hmm.
But when you do it sequentially like that, it takes more time. So
Well,
instead of doing that, yeah. So instead of doing that, companies started doing things like doubling up on the, making a big range of doses or running the single and multiple at the same time, or some other type of way to shorten that timeline, because time is money, because your patent's going to run out.
mm-hmm.
Right. So, and of course, from a libertarian perspective, we can talk about whether patents are a good thing or not. But once the timeline got so long, there were no drugs developed without them. I remember at Upjohn, when I first came, we would develop drugs that did not have patents. But as the timeline got longer, management said, no more developing drugs without patents. And so what these patented drugs are knockoffs of a natural molecule, but they're a knockoff. In other words, there's an extra chemical group on it or something to either make it last longer or absorb better or just enable the company to get a patent. But when you take on natural compounds, your body has a harder time with them, right? So it sort of makes them less safe. And prior to that, at Upjohn, we had several natural products. In fact, I was brought in to look at the natural products, which are called prostaglandins, or icosanoids, as we call them today. These are hormones that every cell in your body makes, and that was one of my specialties. So, things changed a lot with these new regulations, so much so that when the AIDS epidemic hit, and we were trying to find new drugs to help the AIDS patients, they had already figured out they couldn't wait. So they hired black market chemists to make the same drugs that we were working on. And they distributed them throughout the AIDS community in a very responsible way. They paid attention to side effects. They shared what they knew with the doctors and patients who were using them. And in some cases, the FDA didn't attack them because the vocal ones, for example, in California, would have gone into the media and really made them look bad. But if you watched Dallas Buyers Club, you saw that the FDA did go after those who were not so media connected. So they went after these sick people who were just trying to save their lives and threatened them with prison. And in some cases, did send them there. It was very sad.
Yeah.
So go ahead.
I went to school in the 80s and the 90s, and throughout high school and college, I heard a lot about thalidomide and butter yellow and red dyes and all these things causing trouble. And I bought it. I mean, I was a student. I was skeptical of a lot of my teachers because, the teachers would contradict each other. And so I was a little more like, okay, yeah, you're teaching me. And what do I know? But you guys aren't always agreeing with each other either. But I bought into this stuff. It's like, oh yeah, if thalidomide is causing babies to be born missing limbs, that's a big deal. And we need to look into that. And then when I got into the industry and I saw what was happening, like I spent 6 years in Manhattan working at a cancer hospital. And when I saw how long they're dragging out approval processes and how expensive it is, there are lots of orphan drugs and drugs that just aren't cost effective or profitable if you have to spend $100 million to develop it. And what that does is it actually kills people. It kills people like you talked about 5 to 10 years, but I think it's even worse than that because it doesn't just kill people. What it does is it fundamentally alters the direction of research and development.
Yes.
And
yes.
We can't measure how much life we're losing from areas that we're not even studying. And
That's right.
We're not looking at natural products because it's too expensive. I have started taking raw crushed garlic because it has compounds in it that are very short-lived, but have been demonstrated that if you use enough of them, you can protect yourself from the common cold. And I like garlic. So instead of making garlic toast with the garlic being roasted in the oven, I make the toast, and then I just put some raw crushed garlic on top so that I can get the added benefits from that. And I've noticed, just anecdotally, that I can actually breathe in the winter now. And I used to not be able to do that. And now maybe it's the garlic, maybe it isn't, but we can't figure that out because nobody wants to study it. Too expensive,
That's right.
Not enough return.
Well, that's right. And you know, I'll tell you some more stories about this because I'm big into prevention as well and natural products, you know, using them if I can. And you might not be aware of it, but there were two libertarians who founded a group called the Life Extension Foundation. And they really put out a lot of information about prevention and about the effects of drugs. And one of the things they did, this is back now in the 80s, is they brought in CoQ10, which is a natural product, but it was sold in Japan as a prescription drug. So they brought it in, and the FDA went after them and said that they were going to imprison them for life if they could. They had, I don't remember, it was like 20 counts against them or something, because they had been telling people, and they'd been selling CoQ10, and they had been telling people about its benefits. Well, because of these amendments, you cannot make a health claim about any natural product unless it goes through the approval process. The FDA actually sent out warning letters to cherry growers and walnut growers telling them that their walnuts and cherries were drugs because they had put on their website scientific studies showing that these components in these foods were healthy. Well, this is nuts because we all know that if you don't eat, you die. I mean, this is, you know, so obviously there are things in foods that we need. So
there's a carcinogen.
Yeah, so it's anyhow, it's just crazy to go through that. I actually testified as an expert witness one time that it was actually illegal for bottled water companies to put that their product might alleviate dehydration because it's true. But I want to get back to life extension though, because this CoQ10 is really an important natural substance for a number of reasons, one of which it's the compound that you take with your statins, if you're taking statins, to prevent the side effects of statins. Now, statins are a very widespread use drug. And if the FDA had been successful in imprisoning the life extension founders, what would have happened is that we probably wouldn't have CoQ10 and a bunch of other things in this country. And their lawyers told them, you must do a plea deal. You must go to prison. You cannot win against the FDA. And they said, the hell with that. And they did. They fought for years. And they went on radio shows and everything, talked about this. And of course, the time helped them because as more benefits of CoQ10 came out, you know, it became pretty apparent they were doing a good thing. And they were able to get all those charges dropped. Had they not done that, prevention in this country, you know, and all of the supplements we now enjoy would probably have been put at risk. So their website is lifeextension.com. And I really recommend that anyone who wants to know more about prevention, check out their site. They have protocols for various diseases that use both drugs and natural products. So it's, you know, it's a really great place. And of course they do sell a lot of products as well. But when people ask me for one-stop shopping for prevention, that's where I send them.
That's great. I haven't looked at that website before. I'm going to have to go there, take a look at them.
Yes.
So where do you think the FDA is going? Do you think they're just going to continue getting worse and worse, or is something going to happen that will rein them in?
Well, what's happening now is there's been a number of studies done showing that the cost of FDA approval is going up exponentially every year. And if you plot the cost of getting an FDA approval versus what we pay at the pharmacy, there is a direct correlation, which means that the driving force behind high pharmaceutical prices is not greed. It's the cost of getting the FDA approval. It's economics 101. You know, if you pay $2.5 billion per new drug, which is what the costs currently are, and that half of that is due to the time, the 14-year timeline. If you're paying that kind of money, you know, you have a hard time making it back. In fact, only 2 to 3 drugs out of 10 make back their cost of getting FDA approval. And so the whole industry now is dependent on blockbuster drugs, which means that it's very tenuous. And drugs are less safe. If anything, they're less safe. Before these 62 amendments were passed, About 2.5% of the drugs that went on the market were eventually withdrawn for safety reasons. After the amendments, it's 3.3%. In other words, it's in the wrong direction. Now, those numbers might not be really different, what we call significantly different, because they're pretty close in the scheme of things, but it's certainly not going in the direction that the amendments were supposed to take us. And, this all gets down to choice. When you take choice away from people, bad things happen. When you initiate force against them, which is what the FDA is doing, bad things happen. The means that you use dictate the ends that you'll get. It pretty much happens every time.
And with government and media, it's really about fear. In a lot of cases, it's about fear. And I'm not using that in a way to criticize the government or the media. If you have a baby that's missing a limb, that's a picture that can go on TV, and that's what that's what all your friends and associates know about. But if somebody is dying from cancer and they just die, and 10 years later some drug gets approved that could have saved them, the impact is just not the same. The impact is not the same. It's like we could have saved an extra 100,000 people a year if we had done this earlier, but you can't actually show them a picture of somebody who's alive or been malformed because of a drug. And the mechanism, I'm not sure how it's going to fix. I have seen some things in the media lately about how the FDA approval process seems to be getting easier. I don't know whether that's legit or not. I haven't looked into it, but I saw a fearmongering article in the news where they were saying that the FDA is getting extremely reckless with how fast they are approving drugs. Actually, and I was like, I hope so. But
actually, it's not the case. I mean, let me tell you the story of this one cancer examiner, since you brought up cancer. He was Dr. Padzura, I think his name is pronounced. He was head of the cancer section for a long time. I think he may still be. Anyhow, he was not convinced by studies showing that a tumor shrank. He wanted a lifetime study showing that the patients that were treated and got their tumor shrunk lived longer. So, of course, that increases the timeline of the development. Well, then his wife got cancer. And he tried to get her into clinical trials, right? And he found out how hard it was. Even though he was an FDA examiner and he's the head of the cancer section, if anyone was going to get preferential treatment, it would have been him. But, it was very tough. So his wife died 3 years later. And these are his words. I'm going to quote him as close as I can. He said, "I am now on a jihad to get drugs out of here faster." And so he's now trying to push the drugs through. But because of the system's bulk, he's only been able to shave a month off of the 14-year process. Now, I'm glad he shaved a month off. Some people will have their lives saved by that. But it's not enough. The whole system needs to be revamped. And I want to mention that the Heartland Institute, another libertarian nonprofit, has put forth a plan that I think has the possibility of being accepted.
Really?
Yes.
But for revamping the FDA, or what?
Well, it's putting a parallel track. So it's called a free to choose, the free to choose track, and basically,
I have heard of that.
You've heard of it, yes. I figured you might have. So basically, what it does is once the FDA process has gone as far as the initial safety testing and the first effectiveness study, which is, I'd say, about a third of the way through the clinical process, then it can go into the free to choose medicine track, which means it could, in theory at least, be marketed right away. And it's true that in some of the safety studies, we are already seeing positive results. So, so then the requirement for the free to choose track is that they report the results. And of course, then you can compare the two tracks. And I think there are some people who would, or some companies, especially small companies, that would go to the free to choose medicine track, because most of the discovery today is in the small biotech companies. But they have to basically hand off their discovery to big pharma, because if they don't, they can't afford the $2.5 billion for development, right? So this would allow them to be able to have a chance to raise enough money to get their drug on the market.
So here's my wildly optimistic hope for the future. So
yes, I
the
want to hear
FDA
this.
is never going away, and I didn't really follow up on that news article that I read about how they're approving drugs too fast, because I didn't believe it, and I have more important things to do with my time. So what this free to choose track could do, the big problem here is public fear. Because if you can get the public behind something, it doesn't matter what it is, the government will do it. And if the government doesn't do it, then somebody will be put into government who will do it. And it doesn't matter whether it's a good thing or a bad thing. Racism was defended by the government until the public attitude on race changed. And then suddenly the government came out as pro-everybody and anti-racism. It's like, oh, wow, yes, John F. Kennedy did that. No, he didn't. The people changed, and JFK saw, he was able to test the wind and go, oh, this is how we should go. Now, I think that JFK legitimately believed that racism was bad, but he didn't make the change. Martin Luther King didn't make the change. King and JFK were extremely important in the process of getting the government to change.
Yes,
but the people were already ready for that. And what I see happening, especially with the internet and really, really big with the smartphones, is that people are getting more educated about things. Now, the first thing that happens when you get a smartphone or a connection to the internet is you go out there and you find all the things that scare you. And then you freak out about them and you say, this needs to be banned and this needs to be done and this needs to be done. But as that happens, as you grow up and as you get more educated, you start to realize that you need to not act on emotion. And with the internet and with smartphones, this is happening to people younger and younger. I have a 10-year-old goddaughter who is one of the biggest online trolls you can imagine. She is completely immune to the quote unquote horrible things that can happen to kids on the internet. And she knows how to get educated. She doesn't buy a lot of the stories out there just because they've been told. She sees the games, she's playing the games. She's 10. She's not super sophisticated and articulate yet, but she's already so light years ahead of where I was at 10. She's ahead of where I was at 20. And I think what's going to happen is that the FDA is not going anywhere, and it's not going to get cheaper. It's going to get more and more expensive, but alternatives will be done. And eventually people will demand, I want to be able to sign a waiver to try a drug, even if it's not FDA approved yet. And as soon as that happens and an alternate pathway comes out, people will jump on that alternate pathway and starve the FDA out of existence.
Yes,
but
I agree with you. I agree with you.
do you think that's going to happen?
Yes, and it's actually already happening in a sense. I talked to you a little bit about the founders of Life Extension, who were libertarians and fought the FDA and won. They were the first big win for freedom and nutritionals. Before then, like I said, people had ended up in jail and bankrupt. But not only that, there are so many people today who use natural products, vitamins, minerals, things like that. And what's happening is the industry that services them are technically, legally in the wrong according to the FDA. They could theoretically at least be prosecuted. But the FDA doesn't have enough resources to get them all. And so what's happening is people are doing their thing. The businesses are sharing information that probably they could be prosecuted for sharing, but the prosecutions aren't happening. And that's really a good thing, because prevention, is really the way to go if you can do it. So I think it's already happening. And of course, that the right to try was passed, where basically, and the Goldwater Institute was responsible for that one.
Can you say something about right to try? Explain what that is.
Sure. Remember I told you guys about the AIDS patients and how they went to the black market. Well, cancer patients decided they wanted to be able to go around the FDA too, but they didn't want to go to the black market. So they sued the FDA for the right to try, basically. Well, of course, initially the court said, of course. And then the FDA said, oh, you really need to rethink this. And the courts reconsidered and decided, oh yeah, you're right. We can't have people, using unapproved drugs to save their lives. They basically said that in the brief or whatever it is that they issued.
Mm-hmm.
So Goldwater Institute said, okay, you won't do it nationally. We're going to do it state by state. And so they went to every state and they basically asked for the same thing that the cancer patients had. Each state tweaked it a little bit. But when they had about, I think they had 40 states when Trump decided, you know what, I'm going to sign the national bill. And he asked for it to be given to him and he signed it. So,
and now he gets credit for it.
Yeah, exactly. Well,
just
now
like
the problem,
they got credit for civil rights.
Exactly. But the problem with right to try, and I did explain this to the Goldwater people, and they are experiencing it to some extent, is that, so if a company is developing a drug and they're far enough along, they know their drug works, and they want to give it or sell it to the people who want the right to try it, they have to worry a little bit about the FDA, because if they give these patients the drug or sell it to them, depending on, what the provision is, then the FDA is not going to like that very much. And they can punish companies by dragging their feet on the approval, right? So companies are afraid to do this. Now, there have been some that have stepped up to the plate. I'm really proud of them. But, it's an issue. And it would be an issue with free to choose medicine as well, but not as much because they're not as far along in the process. And once they're in the free to choose track, they never have to get an approval. That's all done. So the FDA can only come after them in this first part of the clinical development, which isn't as easy to do as it is on the back end. So that's why I think free to choose would be better.
Yeah, and it looks like, especially with the right to try, it looks like there's a lot of support for these ideas. Because,
yes.
Government bureaucracy, do you know what public choice theory is? Have you heard of that?
Yes, I have, but go ahead.
Okay,
talk about it a little bit.
The basic idea of public choice is that even in a democratic system, what the people want done doesn't happen because it costs too much to express yourself. The best example of it is if I come out and I say, okay, I'm going to tax everybody $10 in order to give this vulnerable group some additional protection or additional help. And you recognize that it'll cost you $20 to say, no, I don't want to pay that. Well, you're just going to pay it because if it costs you more to say no than it does to just tolerate it, then it's going to happen. And that's how that basic idea of the cost of objection or the cost of promotion really gets in the way in government regulations and in government actions of doing what the people want and doing what's in the best interest of the people.
That's right.
That's where the FDA and all these other regulatory agencies just end up getting bloated because the people inside them know they're bloated, the people outside know they're bloated, the public knows they're bloated, but nobody knows how to fix the problem until enough cost has been transferred to the people for it to be worth it to the people. And with the internet and smartphones, that cost of saying, I like this and I don't like this has gotten a lot lower.
Yes.
So we're hopefully going to see a lot more movement and a lot more traction, especially as AI gets involved more. And we're not going, and we can't actually get rid of the FDA. It's too expensive to get rid of the FDA. It's easier to start an alternate pathway and say, okay, well, if you sign this waiver, then the FDA is no longer, you're no longer under the FDA's jurisdiction. And then if everybody jumps onto that, then we just kind of walk away from it and becomes a blue law, one of those regulations that people it's still technically on the books, but nobody can really use.
The waiver's actually been talked about as early as the 70s. Dirk Pearson and Sandy Shaw, put out the idea and actually constructed a waiver. And of course, it went nowhere. The time wasn't right, I guess. But now
there wasn't an internet back then. You couldn't tweet it out to 10 million people in 5 seconds while you're waiting to get on the bus.
That's exactly right. And
the cost of communication is just getting so low mean, there's a big problem with it because that means that fear-mongering works too. But I'm a big fan of history. And if you look at European history today, in the history classes, all we talk about is all the murder and mayhem and all the horrible torture that happened. But if you actually look into it and read about the Spanish Inquisition and other issues where people were being hurt, what would happen is that, yes, those horrible things happened, but then there was this horrific shock and outcry about it. And the Spanish Inquisition ended because the people said, this doesn't work, because we tortured this person, they confessed to something, and after the fact, we discovered they were innocent, and that outraged people. And so then they stopped the Inquisition. And it's through this process of becoming educated and being able to communicate easier with victims and people in power that the change actually happens. And with kids today, especially, getting on board with smartphones and the internet, and a lot of these kids have issues. Kids get cancer, kids get diabetes, kids get all sorts of medical health complaints, and then they don't understand why the adults are not protecting them. And then they get online and they talk about it. And then suddenly you see all these people saying, oh, I thought adults were there to protect me. Until I was 40, I was still very naive about a lot of people and institutions out there. I mean, I've gradually woken up over time, but it's hard. It's hard to expect people to take care of you when you can see the bad effects. It used to be very easy to stay naive your entire life.
Yes, I agree with you. And the reason that happened is because the communications industry, at least the part of the industry that builds phones, has been deregulated. Now, I remember when AT&T had their monopoly, courtesy of government. And I remember MCI challenging them for long distance service. And I remember my long distance bill being cut in half the day after. It was really good.
Or something. I remember the first MCI commercial.
Yes.
I remember that. That was really interesting.
Yes, yes. And without that, it would not have happened. And this is why freedom is so important. It's, we really need to remember that freedom is really what protects us. You were talking about the whole protection thing. And we have this idea sometimes that government's there to protect us. But as we've been talking, it becomes clear that unfortunately, even with the best of intentions, the government is doing just the opposite. And I want to, again, kind of point out why this is. This is because government is allowed to do something that we as citizens cannot. It would be illegal. We'd go to jail. And that's, government can initiate force against its citizenry. It can steal from its citizenry. It can defraud its citizenry without any or very few repercussions. And so, when you have a setup like that, when you have that kind of power, we know what happens. Power corrupts.
Very much. Well, thank you for sharing your thoughts on the FDA. We're about out of time now, but if people need to know more about you, if they're more curious about your opinion and ideas, where can they find you?
Well, the best place is my website, ruwart.com, ruwart.com. There you can, if you go to the lower right-hand part of my homepage, you can see all the connections to social media. If you go to my free library, you can see some videos and read the 1993 edition of my book, Healing Our World, right there online. So there's a lot of information there. And of course, you can always write me a message as well.
Thank you. And we are PolitiPeeps. Please like, share, and subscribe, and ring the bell to get notifications so that you can know everything that we're doing, everything we're up to.